Good morning, Dan and Amy. Illinois Governor Jelly Belly Pritzker doesn't know where he'll be for Thanksgiving, but he knows all the fixins will be there for him when he arrives, wherever that may be. Gavin Newsom doesn't know what's going to happen to K through 12 education in California quite yet.
Oh, but Gavin Newsom, another rules for thee, but not for me. He and his wife and a bunch of other people went to a 50th birthday party for one of his political advisors. I thought we were only supposed to have, 3 separate households. They had multiple family units at this party.
Also, his children returned to in-person learning under a phased-in approach at private schools where his 4 children attend, even though most of the schools in Sacramento County where he lives are shut down, as we see teachers' unions continuing to drive the train with respect to lockdown policies for schools, and now Democrat socialist governors driving lockdown policies in the wake of case spikes around the country. The right policy, supported by the science and the data. For more on this, we're pleased to be joined by Dr. Pham. Again, he is a medical doctor, a real doctor, contributor to the Daily Signal, former graduate fellow in health policy at the Heritage Foundation. Dr. Kevin, thanks for joining us. Appreciate it.
Thanks so much for having me back.
So I mentioned the study earlier in the show. I'll mention to you for reaction. This study from the Icahn School of Medicine at Mount Sinai, New York, in cooperation with the Naval Medical Research Center. 1,843 Marine volunteers, U.S. Marines, volunteered to be quarantined and follow more stringent procedures with more stringent oversight than the most authoritarian governor or mayor in this country could even imagine. And the results, comparing the experimental group with the control group, which was not, of course, subject to the lockdown policies, the control group of Marines actually saw fewer infections than their experimental group colleagues. The difference wasn't large, but still a difference. So one could argue that perhaps it was the overuse of masks, which were continually used in the experimental group, that contributed to the slightly increased transmission because of, not wearing the masks properly and they're not being cleaned properly and so on and so forth. But the upshot is strict lockdown mandates, including continuous mask use and oversight of all of the above, accomplished nothing in this study that has yet to be highlighted, even though it was published in the New England Journal of Medicine. How do you react?
Yeah, I think that a lot of the government impositions on us during all this time, which would be mirrored by these Marines being strictly monitored, a lot of these impositions, they don't have a larger impact on us than our own personal behaviors. So the control group, they were able to go out in their daily lives as normal, and they were probably not just going out to parties, drinking beers with random strangers and stuff like that. They were probably assessing the risk and then trying to mitigate it on their own. And then so, I'd have to take a look at the results, look at the statistical differences and all of that. But from what it sounds like to me is that, yeah, it's going to be the individual's personal behavior that's going to have the greatest impact on whether a transmission occurs or not.
And what about masks wearing? I mean, in that study, they wore not one mask, but 2 cloth masks. And also the CDC came out with a study last month that said of the people in America that have gotten COVID, which is 11 million plus, 80% said they wore masks. 70.1% said that they wore them religiously when they would go outside, even if they weren't around other people, and it's still not working.
All right. Well, the masks have marginal protectiveness for the mask wearer. As I'm sure you've heard plenty of times, the mask is about, in the case of COVID, is to protect other people from asymptomatic or pre-symptomatic infected persons. I wouldn't overinterpret that result from the CDC. People tend to wear mask wearing increases with increased community infection rates. So you would expect people who are in an area with a lot of COVID going around, they would probably wear more masks. And so more people who get infected are probably going to be wearing masks. So I wouldn't overinterpret that result, but this does show that masks are not a panacea. They're not perfect protection.
Help us not overinterpret the comments from Joe Biden yesterday about mask wearing when he said this.
President's now existing, remaining advisor on COVID is saying that they should resist. What the hell's the matter with these guys? What is the matter with them? Resist. You know, every major individual of any consequence in the health field is saying we can save 100,000 lives just between now and January 21st by wearing these masks.
Is that right?
Okay, so no, the vice president has been extremely unhelpful during all of this. I remember he put out this big viral tweet that said, "Don't make masks political. Donald Trump makes masks political," and that
the irony was lost on him. Yeah.
Oh, many things are lost on that guy. But no, this is incorrect on every single level. First off, masks are not a panacea. Masks will not save us from this. There was a recent YouGov poll that found that there is 95% of people are wearing masks, some, most, or all of the time, which means that there's 95% at least acceptance of wearing masks. And even so, we're seeing a skyrocketing number of cases. So masks aren't going to prevent the increased case because people are already wearing them. That's the one thing. The other thing is that this hundreds of thousands of lives that will be saved from wearing masks. That's not true because of what I had just said, but also because those are based on erroneous numbers. Those are based on an assumption of mask wearing that was taken from early in the pandemic, I think March or April, where mask usage was very low nationally, and it was not very high even in New York and Seattle. So if there was a national mask mandate and if there was 100% compliance with this mask mandate, which there will not be, then you're not going to save 100,000 people because people are already wearing masks, and we're seeing that it's not having the effect that they claim that it does.
I wanted to talk a little bit about the vaccines that are in process, one from Pfizer, one from Moderna. Of course, the market reacting yesterday to the good news about the apparent efficacy of the Moderna vaccine that's still in trial. I talked to Dr. Henry Miller, who's the founder of the FDA's Office of Biotechnology and now at the Pacific Research Institute. One of the points that he made about Pfizer that I hadn't heard anywhere else, but this is what you'd expect from experts in the field, actual value-added information. That's just shocking to me because we're so rarely getting it from the television doctors. But Dr. Miller said there's a problem with the Pfizer vaccine, potentially. Not that it's not 90% effective, and that's great. The problem is the vaccine needs to be stored at minus 94 degrees Fahrenheit. And so you're going to have a logistical issue in terms of quick and mass distribution with that temperature requirement for storage. And that's something to be considered. So, there's one thing to say, we have a vaccine and the FDA approves it, but then you still have to stand up all of the transportation infrastructure to transport, where we're talking about millions and millions of doses, whether it's the Pfizer product or the Moderna product or some combination of the two. And I don't know the particular qualities of the Moderna vaccine, if there's something similar in terms of how it needs to be transported. But that's a real, maybe wonky, but material issue in mass distribution that informs how quickly mass distribution could happen, which informs the sort of public policies we should be accepting when it comes to things like locking down.
Yeah, certainly. And the Moderna vaccine does not require as cold of storage. It requires a more, requires a more normal temperature, which is a normal refrigerator. But on that front, the Pfizer has been purchasing special refrigerator units for these, and they're running a pilot distribution program to test out their distribution infrastructure before they actually roll out the entire program.
That's good.
So hopefully they'll have everything ironed out by the time an approval comes down the line, or at least an authorization, and hopefully it'll roll out relatively smoothly. There's going to be hiccups. This is a really unprecedented move, trying to vaccinate a lot of people, but this is a good thing that we're going to have two different vaccines. One of the bigger differences is that Pfizer is doing a lot of the contracting on its own, whereas Moderna is primarily relying on the government contracts, the McKesson Logistical Distribution Network, and so that might affect where the majority of these vaccines go.
Ideally, and I don't know, you tell me if this is underway, but ideally, right, my understanding is Pfizer did not take Operation Warp Speed money, and of course, as you were just suggesting, Moderna did. But I wonder if there'll be some synchronization then, too, if there's a government priorities that may slightly differ from the Pfizer priorities, and that they'll use, sort of operate collaboratively to get as wide a distribution as possible.
I believe so. And just a quick nuance to that, a little caveat. Pfizer did take warp speed money. They just didn't take it for research. They didn't take it for research and development, but they did. They did contract with the U.S. government for 100 million doses. The Trump administration just pre-purchased those to
Right.
So there's that. But we do expect that there's going to be some complementarianism here with how these vaccines are rolled out, just because there is going to be the more centralized logistics strain. And then they're also going to be distributed along more retail pathways. So the bulk of it will first go to people who are at high priority for vaccines. But as time goes on, they're going to ramp up more retail distribution of this vaccine, like flu vaccines.
And it's still a 2-shot vaccine, right? I mean, you get it one day and then wait 2 or 3 weeks to get the second shot, or do you know?
Correct. Both of these vaccines require 2 doses.
I wanted to get your reaction to just get a sense of the dark winter that Joe Biden is describing, and other Western European nations describing too, thus the basis for the lockdown policies. But even in Sweden, the prime minister there, who I believe was the guy from the Muppet Show, was a chef, I can't remember, but he announced public events of more than 8 people are now prohibited. Now schools are still staying open there, and restaurants are staying open. You can still indoor dine, no more than 8 people, and so on and so forth. But to restrict public events back down to 8 people from, I think they were at 300, that is still a restriction and a move. So what does that say about where we are with the spread?
I would say that that's probably the number restriction. I've always found to be a rather dumb restriction, because the virus doesn't care how many people are in a space. The virus really cares about the distance between persons in a space. So if you have 8 people in a convention hall, then I really am not really concerned about transmission there. As has always been the case, what we really should have been doing is focusing A, on risks, and B, on the virological reality of transmission. The sort of metrics, the parameters that we've set up in different states, a lot of them are just untargeted, and they're frankly dumb.
Yeah, okay, that makes sense. I mean, some of this strikes me as common sense too. We were talking about it the other day with respect to restaurants. I can't eat in my home according to my governor with family, but I can go out to an igloo outside a restaurant in Chicago and sit with those same people outside, with the same distance apart. I don't really understand that. Or I have to wear a mask when I'm standing up with them, but I don't have to wear a mask when I sit down 6 inches away. It seems to me that so much of this is sort of arbitrary to try and carve out some semblance of civilization, when what they're really trying to do is, sort of an invasions of the body snatchers, put everybody in a hyperbaric chamber.
Right, exactly. It is all arbitrary, and we see this with it's not just arbitrary; it's arbitrary enforcement of the laws. We see this with Gavin Newsom, and I'm sure in his gigantic mansion he can safely distance within the household, but not everyone has that. But everyone should be able to have the right to assess the risk for their own family and make decisions accordingly. Like, I don't think nobody doesn't know who's at risk by now. Everyone knows by now. I don't think anyone is going to be trying to put their great-grandparents at risk at this time. It's just people can be trusted to care for their own people.
Mm-hmm. And Kevin, Doctor, I can't go to, I'm an Episcopalian, I can't go to church in Illinois, but I can go to a strip club and a casino.
Yeah, I was in Vegas, and I was able to do that. I was able to just walk into a casino, but I had to register at a parish to go to church on Sundays, and that's really not how things. That's not an ordered society.
No.
He is Dr. Kevin Pham, medical doctor, contributor to the Daily Signal, and former graduate fellow in health policy at the Heritage Foundation. Dr. Kevin, thanks for joining us again. Appreciate it.
Thanks so much for having me.
Thanks. And he joined us on our turnkey.pro answer line.
It's like a hot, steaming cup of information to start your day. It's Chicago's Morning Answer on AM 560. The Answer.
Take control of your documents and data with content services and document imaging solutions from IDT and Highland On Base. Those documents are doing your employees no good while they're continuing to work from home. Let IDT show you how to onboard your documents anywhere, anytime, safely and securely into the cloud using